Today I'll be telling you about larynx cancer. Basically about what causes laryngeal cancer, what are the treatment options and what are the first symptoms of laryngeal cancer. Most of the time laryngeal cancer presents as voice change, whether the patient is smoking himself or it is a passive smoking because the other person in the room is smoking can cause laryngeal cancer. How do you diagnose? Basically we do a endoscopy and then take a biopsy. Hi, I am Dr. Avinash Chaitanya, head and neck surgical oncologist. Today I will be telling you about larynx cancer. Most of the time, laryngeal cancer presents as voice change, which is not explained by any cold or abuse of voice. Cold or abuse of voice can cause laryngitis or vocal polyp, which can present as change in voice. But when the patient is a smoker and it is not getting improved by any other treatment, we have to suspect laryngeal cancer. As I mentioned, laryngeal cancer is mainly caused by smoking. Whether the patient is smoking himself or it is a passive smoking because the other person in the room is smoking can cause laryngeal cancer. Of course, without any other cause also laryngeal cancer can come, and sometimes pharyngeal cancer, that is hypopharynx or what you call as throat cancer, can also spread to the larynx and cause change in voice. So how do you diagnose? Basically we do a endoscopy, we see that there is a growth and then take a biopsy, which is mostly done under general anesthesia. And when the biopsy confirms us what is the type of tumor, we have to go ahead and see what is the extent of tumor by doing a scan and then decide the treatment options. Most of the time in early laryngeal cancer, when it is limited to the vocal cords, it is sufficient to do a surgery called microlaryngeal surgery with or without laser, and once we have removed the tumor with adequate margins, the patient can be kept on follow-up. Most of the time this suffices in early stage, that is stage 1 and stage 2 cancer. But as the stage progresses, it becomes difficult for us to conserve the larynx by doing small surgeries. So instead of removing the whole larynx or doing a partial or a complete laryngectomy, we prefer to give chemotherapy and radiation in early advanced cancers, that is T3N1 or T3 cancers, in which we are able to preserve the laryngeal function by just giving radiation and removing the tumor. When the stage progresses further, that is T4A, that means it is either spread onto the cartilages of the larynx or it is not functioning. The laryngeal function is compromised, that is the patient is aspirating or the patient is not able to breathe properly. That time doing radiation may not be correct. So for that reason we give the option of doing a total laryngectomy. So these are the options. Sometimes after chemotherapy and radiation, there is a chance that the tumor has not responded completely and there is a residual tumor, or the tumor comes back. It can come back after 6 months, 1 year or later. So at this time, we are not able to give radiation again to the patient. So we have to offer them salvage surgery or chemotherapy as a treatment option. Salvage surgery has very good outcomes and we are able to save the patient and preserve his life for a long time. The disadvantage of doing a total laryngectomy is the loss of voice, loss of smell and a permanent tracheostoma from where he will breathe throughout his life. So these are the treatment options for CA larynx, but prevention is better than cure. So take care.